Can you describe your job as the Director of Mental Health Services to me?
Yeah, I'm part of the Student Services team, which is part of a department called the Department of Teaching and Learning, which is people that help support all the different schools. My primary focus is on increasing access and also helping to just grow and develop how we provide mental health services as well as behavioral health services.
How can we inclusify mental health services in our schools?
We're always looking at ways to improve access to mental health services for our students and make sure that we're getting trained in all the ways that to provide like culturally relevant services or making sure that we're up to training on like working with different populations. But we also recognize that we can be trained in those things, but that's not the same as increasing access for students who might look around at the mental health providers that are available in the schools, and if they don't feel that they represent who they are or what is important to them, or don't speak the same language as them, that we know that reduces access for people. In this community, we really face a problem with mental health services in languages other than English. And I think partnering with other organizations that might be able to fit in where maybe we can't provide something, but we can know really well what's available and make sure that we help link people to those services.
What solutions to inaccessibility to mental health services do you think would work best?
I want to learn directly from students, like what are the challenges that they're facing. We are working on it will be telehealth services that can be accessed. So we'll be looking at who are the students that we haven't been able to serve or serve well because we don't speak Russian or Spanish or whatever it may be.
Would integrating education and mental health earlier into schools help prevent or reduce risk of youth going into crisis?
Anytime we can help people understand themselves better and develop coping mechanisms, the earlier we learn those things, learn about ourselves and learn about ways to manage them and who to ask for help from, I can only imagine that would help prevent crisis.
What services are directly provided through the schools in Bellingham School District?
We have mental health specialists in all of our schools. We have our prevention and wellness specialists. And then, as I mentioned, we just have tons and tons of partnerships. We have such a great community that want to be helping youth and kids. Like I mentioned, like Compass Health and Unity Care. But we also even other non-mental health specific providers that we know help students. So like Whatcom Dispute Resolution Center, they help with conflict resolution and healthy relationships. But I'm also always looking for new ways to expand and looking at what's out there and what's available and what works within the school day.
I think that these services could be improved or expanded in any way, and you talked about students, their inputs.
I mentioned what I want to do and what I dream of is getting out to the schools more and finding ways to be able to hear that from students. But we also do the Healthy Youth Survey, which is put on by the state, right? And every couple of years, and I look really closely at that information just to kind of see what students are reporting about their mental health or other related topics. And so
what are the biggest barriers that marginalized groups face when seeking mental health services?
If there's any shame or stigma around accessing mental health services, or if a student, for example, doesn't have their support of their parents, but they really want that support, I think those are all really big barriers. It's so hard to find is other language spoken therapy without using a device of some kind to translate or a person interpreting. So that's another example. So I would say language. I would say finding people that they can resonate with for whatever from whatever identity or that they're looking for, and it's not free most of the time. Like finding someone that takes their insurance, or finding a way to get to an appointment in the middle of the day, or whatever it may be. And so those are all huge barriers.
What's your opinion on how insurance can limit accessibility for people struggling with poverty?
A big trend that has started really taken off over the last few years is mental health providers in the community.
Mm-hmm.
A lot of them are not accepting insurance, and they're only taking like cash payment, right?
Mm-hmm.
For a lot of insurance companies, the reimbursement rate is very, very low.
Yeah.
So I think the opportunity is to continue to push on insurance companies to make their process more easy to access, and to reimburse at a rate that is reasonable so that people can accept insurance.
And how do you think access to quality mental health services is beneficial to our community?
To me, mental health care should be as accessible as medical care.
Mm-hmm.
People shouldn't have to sit on a waiting list for 9 months to access mental health counseling and have it be through their insurance or be able to access it free of charge or whatever it may be. It's truly a fundamental right that people should have. And I think in our community, we do a pretty good job of providing resources, but we know that there's a lot of gaps and we know it doesn't meet everybody's needs. I think if we can remove barriers to care for people, which also includes working on destigmatizing mental health services, that I really just think we would start to see pretty significant reduction in certain societal challenges. When people's needs aren't being met, it just increases stress and it increases demands on the system. When if we could just provide and people felt cared for and supported, that our whole community would benefit.